Hi, I'm going to talk to you today about your prostate. A lot of men don't like to talk about this, but your prostate is a small gland that surrounds your urethra at the base of your bladder. It helps make semen, and the urethra is the tube by which your urine exits the body from your bladder out through your penis. The gland undergoes a growth spurt at puberty, and it's normal for it to do that again when you are in your 50s. The changes that occur in your prostate can cause it to squeeze the urethra or to put pressure on the bladder, which causes some changes in your urinary patterns. The changes that occur in your prostate can include inflammation or infection, which we call prostatitis. You can have benign prostatic hyperplasia, which is, as the name says, it's benign, so it's not cancer. It's just a increased growth of cells in the prostate, and even prostate cancer can be an issue. Having prostatitis or BPH does not put you at risk for prostate cancer, but the monitoring methods are similar. Some of the characteristics of change that you need to report to your doctor would include trouble starting urine or dribbling at times, passing urine more often with a strong urge to urinate, especially at night, a weak or slow stream, burning, stinging, or pain with urination. If those changes happen with chills or high fever, or if you experience low back pain or low belly pain, groin pain, scrotum pain or heaviness, if you experience sexual dysfunction or painful ejaculation, if while you're urinating your stream stops and starts again, if you feel like you have to push or strain to start your urinary stream, or if you notice discharge from your penis with bowel movements. These are all things that you need to discuss with your doctor or your NP. When you do go into the office, the doctor is most importantly going to take a thorough history. They're going to review your symptoms very carefully. They're going to look at your family history of any prostate issues. They're going to probably order a urinalysis. They'll take some urine to test for infection, especially if you're running a temperature and have some pain with urination. And they'll check for kidney function with tests. Another very important test for you to follow up on and to do would be the digital rectal exam, and this is where the doctor does put a finger into your rectum, but by doing that can actually feel the texture and on the surface of your prostate gland, and can check for hard lumps or growths, or pain, or just general swelling. This is important, and this is a basic screening process for the prostate, and if you have changes, you will probably need to have one of these done. Now, the other test that they could possibly do is called a prostate-specific antigen, or PSA level. This is no longer a standard for screening for prostate cancer because there are a lot of things that affect the PSA rate, and there were a lot of false negative results that resulted in a lot of overtreatment, overdiagnosis of prostate cancer, and overtreatment for prostate tumors that would have been asymptomatic throughout the duration of a man's life. So they do still use the PSA levels, but generally it's not the first line treatment or monitoring tool that your doctor will use to check your prostate. If you are diagnosed with prostate cancer, your doctor will probably need to also do a prostate biopsy, which is a different topic. Things you can do to treat these different changes for benign prostatic hyperplasia: there are medications that shrink the tumor or the prostate tissue and prevent it from growing more. There are also medications that relax the muscles around the urethra and the bladder to help you urinate a little easier. Some of the things you can do to avoid problems with the prostate and some of the enlargement: avoid drinking at night a lot, so that you're not getting up in the middle of the night to urinate. Avoid alcohol and caffeine. These are irritants to your bladder and to your prostate, and they can cause some of the symptoms that come with enlargement of the prostate to be worse. Frequently to the bathroom, go like every 2 hours to kind of keep your bladder emptied so you're not having the urgency where you feel like you can hardly make it to the bathroom. Avoid over-the-counter cough and cold medicines. Those can also irritate your prostate and cause some of the changes to be a little worse. If you have prostatitis, that's an actual infection, so your doctor will decide on an antibiotic regimen, and that will be generally an extended period of time, longer than just your usual 5 days. And also, again, avoid caffeine, alcohol, spicy foods, anything that might be irritating internally to your bladder. If you have bladder cancer, or excuse me, prostate cancer, the treatment is going to depend on the severity and the spread of the infection or the tumor that you have. It is a very slow growing type of cancer, so the standard at this point is a watchful waiting process where you will just follow up with your physician a little bit more frequently for your lab levels and your digital rectal exams to monitor the changes in your prostate. Other treatments include surgery, hormonal treatments, and radiation, but those are discussed generally with your oncologist or your urology oncologist. And I have a brochure here for you, a little pamphlet just to look at to remind you. And if you have any questions or concerns, come back and see me.